Okay.
We talked a little bit about it at the gambling conference. There
Hi,
was
everybody.
a whole,
now, are we better?
That's much better,
Okay.
Carrie.
Guys, we're having some internet connection, so I have switched offices to somebody who's hardwired, and hopefully we won't have any more issues. I am going to record. Hopefully it's recording despite the issues while it's working on the hardwiring. Since people didn't hear me before, I just want to, or only heard part of what I said. I was just explaining about the setup for the Munch and Mingle, and how if it's your first time coming to one of these, that the way that we select the topic is from feedback from people that work in the community, as well as the community that we serve here and that surrounds us. And then we, from that feedback, we then try to address that need by finding the folks that have been affected by the topic issue, the folks that work on the topic issue, and then allow time for mingling afterwards so y'all can connect. Virtually, that's been a challenge, of course, the mingling piece. However, it has allowed us to increase our reach outside of New York, which has also increased the amount of resources too, which is wonderful. And mingling, you know, with folks that are out of our state and may know of some other resources that we're not aware of. So before I go any further, I'm going to start immediately with Martina so that she can introduce herself and start us off by telling us what she does and the community that she serves, and maybe a highlight or two of that work. Martina?
Hi, Carrie. My name's Martina. I'm a CASAC. I work at New Choices Recovery Center. I also happen to be a person in sustained recovery, which for me means that I haven't had a drug or alcohol, any mind or mood altering substance in about 27 years, including like my birthday and weekends. And the reason I bring that up is because I think it's an important piece to be able to express that this is something that can be sustained, and it's something that it can work, and it's something that can strengthen, you know, not only us as individuals, but us as families and communities. So what I do at New Choices Recovery Center is we're a small nonprofit. Well, we're getting a little bigger, but we're a nonprofit in Schenectady. We have an outpatient clinic. We have 4 halfway houses. We have full day and part-time treatment. I also serve people who struggle with gambling disorders. And I was really excited when you reached out to me to talk about the peer professional role in I'm sorry, it said somebody was speaking, so I wanted to. Okay, I was really excited when you reached out to me to talk about the peer professional role in the clinic, because honestly, I couldn't imagine not having peer professionals now that we have them. I feel like it's the best thing to happen in substance use disorder treatment in years, especially when the clinician and the peer are working closely with each other as well as the client. So Xavier and Brennan will talk more about what a certified recovery peer advocate does and what a certified addiction recovery coach does. But I will say that when a client is ambivalent about their self-determined goals, like what pathway they should take, the peer professional being able to loop in and express that Me Too factor is incredibly useful, especially if the client is in the detox process. That's an incredibly supportive aspect to have. There have been times where I've had to call a peer professional like Xavier or one of our other peer professionals to just talk to the client, sit with them when they're nervous doing an intake, sit with them and talk a little bit about what does treatment look like? What does recovery look like? I can tell a client, you might need some peer support that could really support your walk. But someone like Xavier is the peer support that's going to support their walk. One of the exercises I do in group therapy is I'll hand to demonstrate the importance of peer support, is I'll hand them a pencil and I'll be like, break this pencil in half, and they break it. and then I'll hand them like 10 pencils and I'll be like, now break these, and bound together, they can't be broken. Right. And that's kind of how the CRPA and the CARC work. X, what do you got?
So thank you so much, Martina. That really highlights the importance of the CRPA role. So the CRPA is a certified recovery peer advocate. So it's somebody who's working in the field, who has gone through a number of different trainings about recovery, about coaching, about medical assisted treatment, ethics, and so on and so forth, but someone with lived experience. So the CRPA has really become, and I think this is echoed in Martina's sentiments, the glue in the recovery community, in the recovery system, in keeping folks connected, which is so key because relapse is part of recovery. And if you do relapse, you want to know that there is somebody that you can call who's there to support, not to judge. And I think that's one of the most important factors, is that the role of the peer is to be a support, and that the characteristic of the peer is somebody who is genuine, non-judgmental and compassionate. And I will pass this off to a peer who echoes all of those things in his day-to-day work and life. Xavier McDaniel.
Good afternoon, everybody. My name is Xavier McDaniel. I'm a certified addiction recovery coach, and I am a certified recovery peer advocate. I am also a person in sustained recovery. I've been in the process since June 16th from 1996. I also work for New Choices Recovery Center, as you heard. And, I want to thank you guys for those kind words. I mean, when I listen to that and I hear that, it's probably just me because I have difficulty taking compliments, right? Because I got into this line of work, something that I've been doing for over 20 years for free. I don't know if any of my peers can identify with that, right? We don't do this for fame or for pay, but I do this work because it's just another way of me providing service for my community. So, a couple of things that I do here at New Choices is that I do try to provide an opportunity to meet people where they are, right? A lot of times we'll have clients or recoveries come into our center, and they may not know whether or not they want treatment. They may not know if they want to stop. They may be having family issues. They may be having issues that are a part of the substance use disorder, but they may be homeless. They may be hungry. Whatever their situation may be, and it gives me an opportunity to sit down with them and find out what their issue is, and then to see if we can come up with a solution for their problem. The biggest thing is right here in the area and in this building that I work in, I was homeless right around this building. So when I get a chance to talk to them and I share that with them, it kind of lets a wall down that they might ordinarily have, because they can't say to me that you don't understand, right? And that's one of the things that, even though the situations may not be identical, we can all identify with the feeling of not having, the feeling of not knowing where to go, who to turn to, that hopeless feeling. We all can identify with that. So, it's amazing because, forgive me for not getting that intro. Martina gave me a nice pass. My phone was ringing, and it was someone that needed a winter coat, right? And so this job is challenging, especially now. It's very challenging because of where we're at right now as a society and as a community. It's chaotic in some of our communities. So more than anything else, it's even more necessary for us to be involved. So I also get calls about trying to get individuals doing referrals for inpatient treatment. There are times when I transport individuals to treatment. There are times when I am a go-between between them and, say, the court system. There are times when I go and advocate for individuals at DSS. I just want to say that we give opportunities for individuals to have a voice. And a lot of times, not having anyone that believes in them and not having someone that can support them is vital, right? So in our roles, we can go from a wide range of being cheerleaders, just having an ear for someone to vent so we can just listen. You know, it's almost like we're a Swiss Army knife at times, right? But the most important thing is that we're here to be able to provide a service to someone who may not feel as though they're being heard. And and for me, that's the biggest thing, right? I always want them to feel that they're loved and that we're listening. And even though we may not have a solution at that moment, it doesn't mean that we won't make every effort to try to make something happen. And sometimes that just makes all the difference, that they know that somebody cares. So I don't know if you guys have questions, you know, because I can talk. I don't want to go on and go on. I know that Ben is coming up behind me, and I know that Ben's the technical guy. He's going to sound a whole lot more efficient than I did, but that's my, you know. So I'm going to hand off to him or back to Carrie, and it's a pleasure to be here. And just remember, more than anything else, right? If you have an opportunity to work with a peer, right? The peer has an opportunity to be able to interact with that person in some ways that you may not. And that's going to be vital to being able to reach them so that they can try to reach their full potential. That's all I got.
Thank you so much, Xavier. I really love that metaphor of a Swiss Army knife. I mean, that's so true. And this is why, you know, it's a title. I said, you know, it's somebody that you should know, because often in frontline work and human services work, you will find people, you know, with mental health issues, substance use issues, you know, issues that are overwhelming maybe to your particular position because you haven't had experience yet working with people with these issues. Or you may feel like, I don't know who to turn to or who to refer to, you know, or this person's in crisis right now. And so many of us try to link people with organizations in the right now, right? We want someone to come back tomorrow. We say, no, we're going to help you right now. And that's one of the amazing components of the Certified Recovery Peer Advocate, is the many different ways that they can provide support, and including literally meeting the person where they're at physically and also where they're at, you know, emotionally. And the advocacy piece, thank you for highlighting that too, is so important. You know, often I found prior to there being so many CRPAs here, and talking with folks in the treatment side or talking with folks on the medical side, that there was a lack of awareness of the lack of support when someone arrives in a mental health and or substance use crises. So they didn't realize the damage that was being done by the words, or the damage that was being done by making somebody wait or quickly discharging them because they felt they had fixed the problem 1, 2, 3. And then there was an overwhelming sense of like, well, I already wear a lot of hats and I don't have the time to learn this new information or new verbiage or new approach, or I don't know about you know, so many resources. It's not my specialty. And that's where the Certified Recovery Peer Advocate comes in. And they're also Medicaid-reimbursable, which is a groundbreaking support, because then places like New Choices can not only employ CERPAs in their outpatient treatment, but they can also then make agreements with community organizations to have CERPAs at their location as well. Now I'm going to hand it off to Brandon, who's a Family Support Navigator, because that's another life-saving Swiss Army knife and glue for folks that have family and loved ones that are struggling with substance misuse or maybe struggling in their recovery. So Brandon, can you please introduce yourself?
Thank you for having me on the call, first of all. My name is Brendan Norton. I'm a certified certified rehabilitation counselor and a family support navigator with Healing Springs Recovery Center in Saratoga. I serve Saratoga, Warren, and Washington counties, and my role is to assist the families pretty much from start to well, there really is no finish in this game, but from the beginning until a person is ready to fly on their own. And usually that starts off with some one-on-one, just good old-fashioned addiction education. Besides having the professional background, I'm a person in long-term recovery myself. So for me, that means that I haven't used a mood or mind-altering substance in 6 years, 8 months, and 2 days. And I'm also a family member in recovery. So my life has been directly impacted by the addiction of a couple loved ones in my immediate family. So I get it on both sides of the coin. So I have that lived experience that I'm able to share with the families. Because unless you've truly lived through addiction, I think it's difficult to comprehend, like what Xavier was talking about, was those feelings and the emotions and the thoughts and the pain that kind of brings us to this desperation point. And I help the families understand that, and I kind of give them this like insider view of the mind of what it's like to be addicted. And from there, we go on to discuss how they can almost become their own loved one's recovery coach. I use a method called CRAFT, which is community reinforcement and family training, which utilizes positive reinforcement rather than a punitive approach, because oftentimes it's told to individuals and to families that the best course of action is, well, if they're going to use drugs, you got to kick them out of your house, or take away this or take away that. But they found that rather than rather than taking that punitive approach and taking this loving, compassionate approach with emphasis on some self-care and some boundaries, you get better results when you show a loving and compassionate approach. Because we beat ourselves up enough in active addiction. We don't need our families beating us up as well. And Carrie, you mentioned the words. Words have the ability to hurt more than any kind of physical pain. And we often see families who are hurt and they're angry at the actions of their loved ones. And they may not use the most appropriate language, calling them junkies and addicts and all these other hurtful terms that, quite frankly, nobody needs to hear those words. So educating them on some effective communication strategies is a really important tool that we use a lot. Coaching them to use "I feel" statements rather than blaming for their emotions, and keeping things short and sweet. Never have a conversation with an intoxicated loved one. Those kinds of things. And then I'm also just like a sounding board for families. So they have my number. They'll call me. They'll text me. They'll email me. They'll send carrier pigeons if they have to. Just to run ideas past, they came home sober the other night, and this is what I did. Do you think that was a good idea? And a lot of times it's yes, and other times it's like, well, maybe you could try this instead. So it's never telling them what they have to do. It's making suggestions. We don't should on people. I know I don't like to be should upon, so I don't should upon other people. And just being a sense of kind of like hope and support. My addiction was just like anybody else's addiction, pretty bad. So when they see this and they see somebody who's made it through to the other side and is living a recovery lifestyle and has gone from literally the bottom of the barrel to having a master's degree and almost 7 years sober now, it's really inspirational and provides some hope for families. And that's oftentimes what they just need, is a little bit of hope to hang on until their loved one is ready. And then it's really just identifying resources they need. So if they need some additional childcare, so their loved one can go back to work, let's find some childcare. You know, if somebody's still in active addiction, we have the ability to provide them with some Narcan, some fentanyl test strips, you know, go over some harm reduction stuff with them, so they feel more empowered, like they're ready to tackle their loved one's problems with them, instead of pushing them off to somebody else. So that's what I do in a nutshell, if that helps.
Thank you so much, Brandon.
You're welcome.
It's, you know, it's a field that often, you know, what all three of you do, the CRPA, the Family Support Navigator, the CASAC, that often people are not aware of until they're already in crises. And that's also one of the reasons why we wanted to feature the CRPA, because we want you to know that you don't have to be in crises in order to reach out to a CRPA or to reach out to a family support navigator. You know, this is also a prevention strategy, as well as a harm reduction strategy, as well as a support for recovery and treatment. It's supporting that person along that pathway. And so often when people do find these folks, they're so, you know, they're so profoundly affected. These relationships run so deep and are so invaluable to folks, that it's really important that we get the word out, you know, that these roles exist and they're here, they're right here in the Capital Region. Recently, we launched, hopefully this will work, we've launched a recovery resource book. Second. It's right here. Hopefully you guys are all seeing my screen. There's a recovery guide, services, activities, and resources. And I'm bringing this up now so that if some of you are saying, well, where do I find these peer supports, you know, in the area? In this recovery support guide, there's peer support, there's family support services, as well as the other key principles of recovery. And these key principles come from both SAMHSA, that has a wealth of knowledge and a wealth of researchers, but it also comes from many studies with direct feedback from peers, many forums, etc. And I'm sorry, not from peers, from folks in recovery or folks struggling with recovery. What made that difference? You know, what helped and what hurt. And this is what helped. Treatment navigation, making it easy, making it accessible, making it 1, 2, 3, the expansion of the treatment available. Peer support is just, as they've explained, their different roles and the ways that they meet people and where they meet people, you know, that has been a key, as well as the family support. You know, one of the pieces of feedback too from people in recovery is that when they're on a good path, they come back to a home that hasn't had the treatment or hasn't had the recovery support, right? And so it's very chaotic, and it can sometimes, you know, not cause a relapse, but certainly hinder somebody's success to maintain recovery. And also for that family, their communication, you know, not having healthy communication, being really worn out or affected by this individual process to recovery, not having the right word space, honest space to be able to release that is also so important. And that's where the Family Support Navigator, you know, comes in as well. So do folks have questions? If you do, please just unmute yourself and introduce yourself.
Ask everybody, did they see those really handsome guys on the cover?
Do that again.
Did anybody see those two really handsome guys on the cover?
Oh yeah, let me bring back the cover. Oh yeah. These are some of our recovery heroes right here on the cover.
Aww.
Yeah, somebody's hubby. So this also, the guide was also created with the intention that there's also many supports virtually. So that if someone is seeking support and they have a lot of trouble leaving home, or because of the pandemic, you know, God forbid we have to go virtual, or most of the services have to go virtual again. There's lots of resources in here. Every single section has a virtual resource as well as an in-person. Because also what we've learned, interesting from the pandemic, is that for some treatment facilities and some therapy offices, their attainment, their patient numbers have skyrocketed. That people actually prefer the virtual, and their numbers in terms of making appointments and maintaining medicine because they maintain the appointments, etc. It has a whole ripple effect. I'm going to stop sharing my screen. I just wanted to highlight some of the other avenues of recovery, which is complementary and alternative services, harm reduction services, and advocacy support, as well as just if you need a go-to, you go right to our directory and it's broken down as well. I'm gonna stop sharing here. Okay. And then Martina, Xavier, Ben, could you maybe share a particularly, you know, a story of your outreach within the community itself, working at an off-site location?
Oh, I have one.
Yeah.
And I wanted to mention this before, but I was talking really fast because I was worried I wouldn't get to the school bus at time. So thank you for that. Sorry about that. So one of the things that I really appreciate is the fact that, like what you were talking about, Carrie, about and Brendan too, about wrapping clients in as many different kinds of services from as many angles as possible and inclusive of the family. That's incredibly essential in this kind of work. So the thing about like what Xavier does is his experience and expertise can be applied directly, as opposed to just sort of in a sideways way or filtered through other avenues. You know what I mean? So like, for example, like a month ago, I had a client come in who was just released from prison. He was incarcerated until like 2 days before he came in, and he'd already gone out and he'd gotten a job, but he only had what he was wearing. And so if it was like, say 2013, right, what I could do is I could be like, hey, here's some information. This is where the city mission is. Why don't you go and get some clothes before you go back to work. But what happened was I got to call Xavier over to my office and be like, this is Xavier. Xavier is a peer advocate. He's a person in recovery. He's going to tell you what that means to him. And Xavier, this guy needs some clothes. He's starting a new job, and X got to take him to the city mission and get a clothing voucher for him. And, like in a situation where somebody's just like in that vulnerable place where they're just recently re-entering society and everything's, new and loud and aggressive, and they have to check this off the box and this off the box and this off the box. And now they have to go to the city mission and get a clothing voucher. It really like streamlined the process, I think, for him. And he was grateful. He mentions it every time I see him.
That's awesome.
So that did a lot for not only did it help the client get clothes that day, but it helped him get some support in a person-centered way. And now he trusts the agency a little bit more,
Yeah.
where there would otherwise be suspicion.
Right.
And I really appreciate that. Like people that are working with CRPAs, generally do a lot of really good clinical work because the CRPA is working with them on what their real actual goals are, not what a probation officer's goals for them are, but their goals. And that's pretty clutch.
And Martina, what's pretty clutch too is your phenomenal sober events and outings. Can you just share some of those? Like I can't express how much joy I get from seeing those photos and the events announced. So if you could just share some of those and what those are about, that would be awesome.
Sure. A big piece of getting sober and staying sober is changing your relationship with your world, the world around you, you know, changing your relationship with cravings, changing your kind of idea of what fun is, and bringing a new attitude into just the world around you and what you're able to do. So something that we've done at the clinic is we worked on a lot of different things, like holiday projects. You know, a couple of years ago we had a pajama party, so we had people come with their families. They could wear their pajamas. We screened the movie Elf. It was really awesome, and it helped people sort of reinvent their memory of a holiday, you know, that might have otherwise have been painful for them. We took some clients to the Great Escape for Fright Fest the other night, and somebody actually said to me, I never thought I could laugh like this sober. You know, those are important events. And Ben Deeb can tell you a little bit, if he's still on, about the Saturday fishing event that he started. I began bringing some of our New Choices clients up to that every other week, but that was a really important event that kind of got people together when everything initially shut down during the pandemic in 2020 in March, and there were no services, there was no NA meetings, Healing Springs was closed, we didn't have any groups available, we were all just learning Zoom, you know, the dark days. So he can tell you a little bit more about that, but that was an initiative by Healing Springs, by the sister there, to bring people together in a.
I think your phone just cut out, Martina, but Ben, if you're on the line, that would be fantastic if you could introduce yourselves, another phenomenal Serpa and also someone on our cover. So if you could talk a little bit about that as well, that would be great.
Yeah, sure. So my name is Ben Deeb. I'm the peer supervisor for Healing Springs and the jail Serpa for Saratoga County Correctional Facility. Yeah, so when all the services shut down and peers were dropping off and we were losing people at like an astronomical rate, I was thinking, like, I have to figure out a way to get people back together safely. And we started something called Serenity Saturday at Lock 5 in Schuylerville. There's like a 400-foot long wall along the river, and Healing Springs donated some fishing poles. And I talked to the local bait shop owner who donated some bait, and we just got peers together to keep that much needed connection and recovery conversation flowing. A lot of people said, this is really saving my life. This is the only place I have to come and have positive conversation. I mean, even as folks in sustained recovery, losing our in-person meetings and our supports was a hit to the entire recovery community. But the folks that were just coming in or trying to get into recovery, it was a huge barrier not having any services. And to speak of like the importance of outings, it's like trying to tag new memories, new positive memories to events that were always spent under the influence or had bad memories attached to them, is imperative. Like, you know, I had a guy that I asked to come fishing for probably 6 months of that first year who kept saying, I don't know, I always, you know, associate fishing with drinking, and I was able to drive him there and accompany him to that and remove that anxiety. But I'd like to speak to like the peers in different settings. Is like we were that missing piece of someone coming in and having a conversation around, you know, these are the mutual aid meetings that are available and this is where they are. And then they would come back and outpatient CASAC or whatever would say, you know, did you attend any meetings? And they would say, no. Well, we're the ones who are really able to have that conversation around what the barrier is, and then accompany that person to that meeting or meet them there to remove the anxiety of going in. And doing all the outside of the box things that we're able to do was like the missing piece to program compliance and graduation rates and, you know, longevity. we have peers. So Healing Springs is lucky in the aspect of the recovery center model. We have peers embedded in almost every system of care in Saratoga County. We have a peer in the emergency room that they call when there's an overdose or someone in the hospital has SUD, and we can go bedside and have a conversation with them around possible treatment connections, or just let them know what we do at Healing Springs and that we have coaches that can do wellness plans with them. We have a peer on a homeless outreach team that's going out into the homeless encampments, finding out if they have immediate needs and trying to connect them to housing resources and recovery services. We have a peer on the drug court team that's assisting the drug court with graduation rates and retention, and trying to do coaching sessions with their participants to try and find out, what's been working, what they haven't been doing, how to make them have a more stable recovery regimen. There's a peer on the homeless court team. We have a peer at the center, and I work here at the jail 4 days a week because of my, a lot of my background is corrections based. So I've done quite a few years in the prison and jail system, and I know how hard it was to have a voice in court, to be able to get where I needed to be, to get the connections and services I needed to be successful. And then I knew the lack of re-entry planning or services that were currently in place so that people could be successful when they leave 6 months later with less resources and no knowledge that they didn't have when they came in. So, I really focus on making those connections with the Me Too statement. The best thing that's happened is some people that were in the jail knew me from before I got in recovery. And they were kind of like, man, they let you walk around in here, And I was like, yeah, they do. And they said, what'd you have to do to get there? And that's like the biggest open door I've ever seen. And I was like, come on, have a seat, man. Let's have a conversation around what I had to change in my life to get where I am. So that Me Too statement is so powerful, and it removes barriers and helps me to build trust bonds with pretty much any of the peer base, but especially here in corrections, where I can really have change talk conversations with people around criminal thinking and core beliefs and things that I couldn't bring into recovery that were created through correction systems and active use. Our ability to accompany people, X and I have actually been in court together for a peer, to be able to stand up in court and advocate and have the judge actually respect what we have to say around the progress that an individual is making and the effort that they're putting into recovery, accompany them to DSS and make sure that they're being treated and humanized and being treated like they're supposed to be. I coordinate constantly with parole and probation around what's best for the individual. That, listen, prison is going to induce more trauma. Let's get this individual where they need to be to get some addiction education and actually have a shot at recovery. So our ability to touch all these different facets as peers is really something that had been missing up until now. And in the outpatient settings, the peer is usually the one person, or the peer professional, us, is the one person that the recoveries can have an honest conversation with that's non-consequential, that doesn't have to be reported up. So generally we're able to talk to them and find out what truly is the barrier to attending your groups, or why does reoccurrence keep happening? What really, what aren't you willing to do? What's holding you up? And I'm sure X can speak to the fact that they'll generally tell us the truth, that they may not tell someone that has to write a clinical note that's going to CPS or drug court or somewhere else. So I love what we do. I love being that lighthouse, that beacon, that recovery is real. And it'll, especially in this environment, it allows me to role model what recovery looks like and the difference between what some of these folks remember me as and who I am. Thank you.
Ben, thank you so much. You really highlighted so many aspects of the peer role and also highlighted the availability of them. Could you just speak a little bit more about what it's like working in the jail and how you got that program, up and running and implemented, and some of the roles that you've had there, like recovery planning? Are there groups there?
Yes, so I'd love to. So actually I was invited into the visit waiting room. Brendan Norton had a family recovers together table up there, engaging family members that were coming to visit inmates on what services were available to them. A lot of times the breadwinner is removed from a family, and that family unit really struggles around making ends meet, daycare, food. Brendan was up there engaging them. He asked me if I would come and see an inmate that had addiction issues in their visit time, because it wasn't something that he had experience with. I did do that, and through conversation with some of the moms and wives and husbands, it got quickly spread that there was someone here that had been where they are that was willing to talk with them and advocate for them. And it kind of became where I was here voluntarily every scheduled visit time all week, visiting inmates off family requests. So they would ask the inmate if they wanted to see me, and then they would let me know, and I would go back and see them on their scheduled visit time. So visitation is very important for the population here, for morale, just for general well-being, to see people that they love and know there's people out there for support. So Brendan and I put together a proposal to open up availability to see me to the whole jail, and met with the colonel, created a quick 4-minute video on what a CRPA is, what I was hoping to do for them, and what services I could help them with, and brought it to the meeting, and the jail administrator accepted the proposal and offered me a desk down in booking.
That's fantastic.
Yeah, and let me right in the jail. So they were bringing, the peers right up to me in booking to see. I was doing peer intakes, and then getting releases signed and sending them to attorneys, and doing a lot of advocacy for them to get alternatives to incarceration. We had a few individuals, unfortunately, leave here that were taken off of maintenance, that fatally overdosed within days of being released. So I really started a heated conversation with the jail administrator around what it would look like to continue MAT for people coming in with scripts. We went down to the SHARP program and overviewed that, reviewed their policies and procedures, and Colonel Emery decided that we were going to start a MAT program here for Suboxone, Methadone, and Vivitrol. So we can, we have a coordination of care agreement that goes out to the provider that upon release, they'll agree to take them back. And we started continuing individuals on their maintenance for the whole time they were here. Right around that time, bail reform hit, and we had some open space here in the jail. So again, I kind of started prodding the jail administrator and said, how about we designate one of these units a recovery pod? So we started developing procedures around what that was going to look like. We had a coordination meeting with all the community stakeholders that had a desire to provide programs at the jail, that made a presentation on what they wanted to do here. We had a meeting about the meeting of what we wanted to utilize to get the most rounded wellness for the individuals in that pod, and came up with a 20-hour-a-week schedule of events for the 31 men in that unit, and started programs. So we had captain coming in, getting ahead while getting out. We had the employment and training agency coming in, doing interviewing skills, resume writing, job readiness, that we were hoping to turn into kind of almost not a work release, but like a job placement opportunity where we could talk to employers to see what they wanted and then try and implement trainings for the population so that they had job connections. I run an addictive and criminal thinking group. The LMSW runs a codependency group. We had parenting inside out with enhanced visits. So there's an hour a week of extra visit time in a schoolroom, hands-on visits for the individuals in the parenting class where they can color, build Legos with their kid to rebuild connection and reduce trauma to the children. Because, you know, with the overdose rates, having one parent deceased and one incarcerated, and then the effect of that on the upcoming generation is huge. And we had actually had yoga and meditation going. And then we also had a couple, we had a smaller population of veterans at that time. So we had the veterans in that unit, and we had vet services coming in, making sure they knew what services were available to them and their peer-to-peer connections. So we had pretty much a fully functioning treatment center for 31 individuals in the jail. And I focused on re-entry for that pod, but that pod specifically to make sure they were they were connected to care managers that agreed to come in and intake them pre-release, so that they were already enrolled, so that there were no gaps in services. And I'm able to start insurance for everyone before they leave, make primary care appointments. So we fully discharge plan everyone.
Ben, this program and the work that you're doing and the work that you're able to accomplish at the jail is not only phenomenal, but it's inspiring. And I would love if you would please share your contact information in the chat, because I feel like people are definitely going to want to be reaching out to you about some of these. And our other presenters, Martina, Xavier, if you could do the same as well. And I'm sorry that we didn't have time to go around and have people do introductions, but if you wouldn't mind, the attendees also, if you could introduce yourself in the chat, and also have any questions put into the chat, and then I could ask the three. Thank you, Ben. And Xavier, I'm going to pass it over to you. Let me unmute you. I think you're muted. You have to unmute.
Okay.
There we
I
go.
put my email in the chat. Are you talking about in regards to answering any questions? I don't really see any. I'm
Yeah,
sorry.
about working in the community, some of the experiences that you've seen. You've worked in a number of different areas, you know, including before you were a certified peer advocate, as you mentioned, you were working in recovery and doing this work for so many years. Yeah, if you could just talk about what that's like, you know, doing that in the community before someone reaches, you know, new choices or the hospital. Or another program. Again, I think there we go.
There's a few. I'm just trying to think what's okay. So because I have been a fixture in the recovery community, in the Capital District, and I've been blessed, tri-state area, however you want to call it. I've had a chance to meet a lot of different individuals, right? And so there was more than one occasion where I had interaction with individuals that I've known for 10 plus years. And individuals at one point in time where I know where their issue started, and the fact that even after seeing them, they could still continue to suffer in their addiction. So seeing them walk into the clinic is a definite plus, but also knowing, like, there've been times when I've had individuals come in and I hear their last name, and right off the bat I say, "Oh, your name is Jones." I said, and one of the things about me is that I don't have that pretense. I'm, you know, I can't afford, you know, people's lives are at stake. So I'm not going to always be proper. And, you know, I just, and that's another thing that helps individuals that break down that wall, because I talk to individuals in a manner sometimes where they feel comfortable. So I ask them, who are your people? You know what I mean? And so as a result, I'm like, oh, wait a minute, hold up. You got an uncle named Fred, you know, your aunt's name is, and as a result of being a fixture in this community, it gives them an opportunity to say, oh, you know a lot of my family members. I'm like, yeah. You know, and I remember your uncle when he passed, you know, he died of an overdose, you know, and I had a situation like that. And that person struggled for quite some time, but my understanding now is that, you know, he's been able to put some time together and he goes to meetings, he's got a sponsor, he's working, you know, but those moments are priceless. You know, just being able to put someone at ease, and I think Ben and Brendan, I think they all talked about just that air of having someone that can really identify with the mess they've made, you know, because that's what we do, you know, and in the process of being dealing with substance use, uh, we make a mess of our lives, right? Because of the choices that we make and the decisions that we make, uh, we just mess things up, right? And part of the problem is not knowing how to get out of that hole, not having a clue of what we can do to get out of that mess that we're in. And having someone that has already been in that hole to help us out of it is crucial. So,
Yeah, I think all three of you have spoken to that non-consequential, non-judgmental, readiness, been there, me too, here for you. And that not only builds kind of an instant connection, because the me too piece and the you can open up to me, but it also opens the door to allow trust back in, where for so many folks, trust has been broken and violated in a lot of ways. I just want to ask each of you if there's one thing that people take away from today and from this role of the certified recovery peer advocate and other peer advocates that are on this call. Thank you for coming. So please feel free to also answer this. What is the one thing you would want people to know about the certified recovery peer advocate? And I will start with you, Xavier. Sorry to throw it right back at you.
I guess the biggest thing is that help is available and we do recover. You know, I think that um, some of my colleagues talked about medication assisted treatment. And there are certain persons that feel as though individuals that participate in MAT aren't recovering, right? But we don't have that conversation with individuals that say may suffer from diabetes or they're on medication for their heart or whatever else, right? And so reducing the stigma and letting the individuals know that, like, you know, one of our sayings is that you're in recovery when you say you are, you know. And quick one, my sister struggled with addiction for a number of years. And I never forget, she went to treatment. She lives down in Atlanta. She went to treatment and she got out and she was doing okay. And then she had a reoccurrence. And I never forget, she said to me, I don't think I can do this like you do this. And I remember saying to her that you recover when you say you are. And about maybe 2 weeks after that, she called me back and she told me that, like, she started the process. In February, God willing, she'll have 3 years, right? Last night, I got a chance to do service with her. And we went into a treatment facility in Chicago on Zoom. And and I was able to speak to a group of folks. So this thing is it's bigger. It's just something right now that, like, if I can't speak for everybody else, but I just know that if I don't give it everything I have, because we've all been through this for a reason, right? To be able to get in touch with our purpose. And that's what I believe my purpose is to be of service. So I think that's why all of us are so passionate about what we do. And if you listen to each one of us, you can hear the passion that we speak with about what we do. So I'm gonna stop where I get emotional.
Thank you, Xavier, and it's a beautiful and empowering story. And a really important piece to take away is that recovery begins when you say it begins. That kind of releases a lot of the pressures and judgments and stigma when you free somebody up to claim that space and claim it when they're ready. So thank you. There was a lot of valuable pieces in that. Brendan? Brenda, I think you're muted also, if you could just unmute. You're muted.
I'm unmuted now.
There you go. We're
Okay.
good.
Well, there was one thing I wanted to mention too, when just real quick about the jail program
Yeah.
was, one thing that Ben and I did was talk to the head of the Corrections Officers Academy at Saratoga County, and we got him to have us come into the academies when there was new officers or some of the senior officers were in there doing some trainings, and did some addiction education, some Narcan training, and helped dispel some of the stigma behind addiction. Because it's a lot of the officers' attitudes towards SUD in jail is negative, and that they're bad people doing bad things. And we were there teaching them that no, there's sick people who are doing sick things to get the thing that's keeping them sicker. And once they started to come around and understand addiction a little better and seeing that people do recover, especially, seeing me and Ben standing up there talking about how we're people in recovery and that there's living proof that people can and do recover from this disease. And it helped get a lot of buy-in from some of the COs that were kind of important for Ben to make some of the progress that he was able to. Did I miss anything on that?
No, that's fantastic. I just wanted you to also just share your one takeaway that you would want people to have about the role of, for you, the Family Support Navigator.
The one takeaway is not to be ashamed because you have somebody who is struggling with addiction in your family. Xavier was talking about it. We wouldn't feel shame if somebody in our family had type 2 diabetes or cancer as a result of, quote unquote choice that somebody made. And to talk about this stuff, because you never know who's listening. And oftentimes it can help younger members of the family, maybe a younger brother or sister, and they see somebody struggling and they talk about this stuff openly, and they don't hide the fact that there's a substance use in the family, that it makes it easier for the person to recover, and could also help prevent a younger sibling or somebody else in the family, and that really there's more family support than there was. But I really want people to take away the fact that we need more family support. Not a lot of people know about Family Support Navigators, or the fact that outpatient clinics have family programming. And quite frankly, I don't think there's enough Family Support Navigators. There's some of us that I have 3 counties. There's a couple that have 5 counties. So we're stretched thin, and we need more.
Thank you so much for that. You brought up a number of really good points and things to take away. One of them being what you were closing with, which is people, that we don't have enough people in this field, right? This, we've seen sadly with the pandemic and the issues that it's risen, as well as, you know, knowing that substance misuse was present and not going away and growing. We've had a very sad record-breaking year of overdose deaths. So we know that there's a need for peers everywhere. We also know there's a need for family support navigators. If somebody is on this call, an attendee, and you're interested in learning about becoming a certified recovery peer advocate, or becoming a family support navigator, or becoming a CARG, which is somebody who had a loved one that struggled with addiction, or they themselves, but it frees up that one piece so that if it wasn't yourself that was struggling, but it was somebody in your family or in your life that was, and this is your calling, please reach out and I'll be able to connect you with the various trainers in the region, and also provide some more information. So thank you for that. And also in regards to the specific job that you do and the model that you utilize, CRAFT, it's C-R-A-F-T, just like the regular word craft. And if you want to go on to Oasis at their site, they have it's a short video about CRAFT and about what it does. So to learn more about it, I think they also have a downloadable toolkit as well, or to reach out directly to Brandon too. But as he mentioned, he is really, really stretched thin, covering so many counties and so much family that needs that support. And that's the other piece I just want to speak to that you mentioned, and that also Xavier mentioned, is that immediate stigma, that immediate chain that happens when either yourself is struggling or a family member is struggling, and you know, and comparing that to when we find out, you know, that someone has a heart issue or has a diagnosis of cancer, right? There's actually such an increase of support for you, right? Like people want to wrap you in support. They want to do outreach campaigns. They want to do fundraisers. They want to do meal deliveries. And that's not what happens with substance misuse. And we are also working hard to change that. But in the meantime, SERPAs and family support navigators, they are those people. They are the people that will wrap their arms around you and your family members with that support. They are the people that will get it and that want to go above and beyond to help you and connect you with what you need. So thank you for that. And Martina, can you highlight one thing you'd like people to take away about the work that you do? Oh, I think you're also on mute.
Thank you. I apologize. I'm just
Okay.
noticing how many people are on here and like how much physical space, how much geography is actually being covered by providers and caregivers on this call. And I want to first off thank everyone for the amazing job that you do and just for being present. It's an honor to be able to talk about just to have this conversation with other people, with like-minded persons. And the takeaway I would ask is, we're dealing with a substance use disorder, and any addiction is like a complex mosaic of pain and trauma and loss and compulsion and family tears, you know. And it's okay like to take a breath. Like at the clinic I work at New Choices, we want to sit down with you and we want to walk with you through this, you know, in the way that is most supportive to you. All right. So if you have clients that are struggling with substance use disorder, or with disordered gambling, or who have family members who are stuck in harmful behaviors, we are happy to help anyone. You know, just definitely, I put my email up there. Just give us a call. We really strive to be person-centered and help the client to self-determine their goals and improve their quality of life. You know, I guess that's what my takeaway for this would be.
Thank you so much. And it's true, there's so much to say about this role. And also, you know, with the passion and the compassion, you know, that all three of you come with, and for Ben, thank you, you know, as well as many others on this call and others, you know, in the chat boxes. We are not the type of folks who, when you call, we say, oh, that's not our county. Oh, we can't help you. No, we're on the phone, we're paging, we're calling, we're texting. We help people from, out of state, actually out of the country as well. So I just want to throw that out there too, that if you're like, I'm not necessarily familiar with these organizations, it's okay. Like, please, we want to hear from you, and we want to help those that you want to help. So thank you so much, Martina. Thank you so much, all four of you. And is there anybody else that's on the call that's a certified recovery peer advocate or recovery coach that would like to share as well? Maybe muted. So if you're trying to talk, please just put it in the chat. And I will be sure to double check whether you are muted or not. In the meantime, I'm going to share my screen so I could just highlight a couple of resources that go hand in hand with what we've been talking about. So here we provide health insurance, enrollment assistance, literally people walk in, call in, virtual, every type of situation, advocacy for folks that aren't getting the appropriate treatment. These are the resource guides that I was shared with you, the recovery on, which will be shortly added to this slide, but you have a social determinants of health guide as well, and that has a tool in it that helps you navigate the exact social determinants of health support that the person needs. So anybody can pick up that guide and begin utilizing it. We have all of these guides available on our site for free. You can download them for free. If you need a physical copy of something, we have that on a limited basis, so please just email me. There's also a mental health guide. There's a refugee support guide. We're again creating these things out of response to the community and saying it was really hard to find X, or it was really challenging when I reached out to this one and there wasn't any, they weren't offering that service anymore. So there's lots of options within these, but straightforward, not overwhelming, and right here and available, and that have been vetted as well. The other piece that we offer is the training, all types of workshops, etc. So if there's something that you would like to present on, or you're like, you know what, my staff has really been struggling with blank, or myself, I've really been struggling with blank, it would be great because I've heard from others that they're looking for this too, to have a training on, whatever the case may be. Please reach out as well, because as I keep highlighting, we try to do this directly in response to the feedback we get. Lastly, but importantly, there's data, tons of data available right on our site. All of these resources are free, they're readily available. You can customize your own data dashboard, you can download as much as you want. Also, everything is mobile friendly too. So you can get on there and from a phone and quickly be able to access resources. And then I just want to highlight there are two calendars on here. There's a professional development opportunities for the community health professional, and then there's a general public health calendar as well. So if there's something also that's an event happening, or a particular training happening that you would like people to be aware of, we will put the development opportunities over here, and we will put the event over on the public health events calendar. So that's also a terrific site to just play around on. There's so much to see, and there's also a self-management guide, which self-care is healthcare was a campaign that we had done, and I've sent this out to quite a number of folks and gotten really great feedback, especially in the times that we're going in, because there's interventions that are just a minute long. There's intervention in 3 minutes. There's intervention you could do at your desk. There's something you could bring home with you, that really helps. So I just wanted to highlight those few things and echo Martina's sentiments to just thank you all so much for the work you're doing. I've been listening, to our panelists, and also, looking at the chat box, and it's really just incredible, the force that we have out here that want to help and want to see where they can help and learn more about this profession. So I just want to thank you all. Let me just add my email in there, and then also, because I was not on my computer, I wasn't able to access my files, but I'm going to send out a few slides that are just explaining what the certified recovery peer advocate is, the difference between that and a CARC, also what it is not, as well as just some stats to help highlight and help maybe make a case for CERPA being at your organization. So thank you all so much. I'm going to end just a few minutes early and hope that the rest of you have a wonderful rest of your day. Thank you.
Thank you, Carrie. You're awesome.
Thank you.
I appreciate you.
Thank you so much. Take care, everyone.
Thank
Bye.
you.
Carrie.